Good day, whether it be night or day. Yours truly, Professor Dr. Dolphy Gilpin here in the lecture theatre, Decatur, Georgia, and with another excerpt on medical malignancy in the bodies or abnormalities. And tonight we're focusing on the obstetrical and gynecology, so-called column. I think the last time I've done something on this, the endometriosis or endometrial carcinoma, was approximately 4 years ago, approximately, I say, upstairs. Now I'm downstairs here in the lecture theatre, and the endometriosis or endometrial carcinoma, which is like a cancer. Well, we could take a pap smear using a speculum and other relevant instruments, pass it up the cervical canal, the vagina cervical canal, and return. If a positive is returned, then we'll do the necessary surgical procedure and the necessary drug treatment. Okay, so this is the vagina and cervix in a more miniature sort of a scale, and a more miniature sort of a scale, and this is a bigger scale or max scale. I'll show you a bigger slide later on, but I've been doing this theoretically and practically since about 1986, practically since 1990 to 96, down in the Caribbean, but I don't mention down in the Caribbean for they are very, I was trying to leave out the Caribbean out of this thing because I've divorced the Caribbean for their criminal activities and almost murderous activities that they almost killed me down there over this thing. So I don't mention them. So 1990 to 96, you will see it all over my medical history. I did intense studies in all the fields. Hematology, endocrinology, cardiology, neurology, neuro-ophthalmology, otolaryngology, dermatology, hematology, podiatry, and everything. All in one, comprehensive medicine. And then 4 years ago upstairs, and then now. Let's give a magnified view of this thing. So there we have the uterus and cervix and fallopian tube. Here we have it. So this is where you insert the speculum and other relevant instrument and get your slides there. The cervix and vaginal canal, the uterus, fallopian tube, ovary. All right, I will not be doing any prescription or anything like that during this phase. What I'll do, all my solutions, that is the drug part, or then sometimes you have to use surgical procedures to help to alleviate the problem of endometriosis or endometrial carcinoma, and sometimes it remains with the patient throughout life, but it can be treated and for them to have a better and healthy life. So here we are. You could find a solution of these on these IPCs, the various hormones, norepinephrine, and sometimes progesterone. That is the traditional thing used to use back there in the 1990s. I don't know what the modern synthesis or applications are that use some combination, modern hormonal therapy and all of that. But here we are, 100 and something slides with solution to comprehensive medicine in hematology, cardiology, ophthalmology, endocrinology, otolaryngology, epidemiology, and so on, podiatry, obstetric and gynecology, pediatrics, and even neonatal medicine solutions. And this is as far as I go. I won't be doing any sort of prescription to collect over the pharmacy. All my solutions are here on these IPC slides for analysis and study by medical students and whoever is interested. Yours truly, Professor Dr. Dolphy Gilpin here with endometrial carcinoma or endometriosis.